Many of the other countries who have attempted something similar have taken years to complete something like this. Then, again, if we look at the scale, diversity of India, the scale of it really hits us then. Hi, I'm Anushka Jain. I'm a reporter at the Ken. I've been covering health tech for the last year or so, but particularly health tech in the government side of things. Today, I was sort of looking forward to perhaps decoding what the Ayushman Bharat Digital Mission, which is the government's initiative for health digitization, is all about. Now, it's basically the government's mission for digitization of health. It was proposed in the National Health Policy of 2017, where it was looked at as a solution which would solve the issues of lack of infrastructure, lack of doctors, and essentially very importantly on patient side of things, helping ensure that patients manage to get longitudinal, comprehensive record of their health information. The first blueprint for the Ayushman Bharat Digital Mission, then known as the National Digital Health Mission, came out in 2019 by a J. Satyanarayana committee formed by the Ministry of Health and Family Welfare. The ABDM was launched in August 2020. Prime Minister Narendra Modi launched it from the ramparts of the Red Fort. He launched it at first as a pilot across 6 union territories. And subsequently, nearly a year later, in September 2021, it was rolled out across the nation. Now, since then, we've had an infusion of funds into the program. February 2022, the mission received a cabinet clearance to the tune of 1,600 crores. Now, a lot of the distribution for these sort of funds is, of course, quite scattered, as you could imagine. But one of the initial focuses of the mission has been to create and populate the registries that it's envisaging. Now, while getting into the registries, let me just explain to you the basic structure of the ABDM. Here you can look at the basic structure as envisaged for the Ayushman Bharat Digital Mission in the NDHB, which is the National Digital Health Blueprint. There are 3 different types of registries. One is for your health IDs, one is for your health professionals registry, and one is your health facilities registry. These would contain information about health professionals such as doctors, nurses, etc. One would contain information about health facilities such as hospitals, clinics. And the health ID essentially is like a common identifier for all citizens to sort of help consolidate all of their electronic health records, which I mentioned was one of the core aims of the ABDM. So now on top of all of this are all of these different sort of components, right? Like you have your health analytics, you have your health information exchange, health locker, etc. But looking at it from a consumer side of consumer perspective, you're going to have these registries and there's going to be a layer called the unified health interface at the top. There it's going to facilitate exchange of health information. So say, allow people to conduct teleconsultations across the country and even exchange fees for the same. There's also plans to have a health claims platform on the side of this, which would essentially help, digitize the process of claims processing. That's at a very nascent stage right now. The NHA and the IRDAI only recently announced that they're working towards that. Then there are also components like a health analytics platform, which will give you some sort of epidemiological information. And there's also something called the drug registry, which is being planned. But that basically is to sort of have a good, a top view of all the different drugs in the country. It's at a very nascent stage right now. The ABDM follows a sandbox process for integration. They run a sandbox. There are different milestones that each potential hopeful integrator needs to complete. Which is creation of health IDs, registration of health professionals, facilities, and creation of health records. Then you also have integration of the entire health management information system, which is just a more logistical sort of a system used by different hospitals, laboratory chains, etc., to digitize their own processes, manage information that comes in, and so on. This has been going on. And the NHA had in late July announced that they have already integrated 50 such applications. Now, this can be something like a personal health records app, which essentially helps you to go and look into your electronic health records. And then you'll also have something like, say, the health management information system used by, just for example, Apollo Hospital, because they've finished this integration. Essentially, what it would allow would be that they would be able to provide services, use the resources of the ABDM as well. And, essentially, they are ABDM compliant for whatever standards that the ABDM wants to hold for itself. There are also thousands of integrations that are currently underway, as is claimed by the NHA in various press releases. Now, to materialize all of that, the ABDM would need quite a bit of participation, both from the private sector side of things as well as the public sector side of things. Most of the healthcare in India is conducted on the private sector side of things. It makes complete sense that there's a huge requirement for the private sector to integrate, but also public sector, since the onus of digitizing hospitals at different levels falls onto the states. So all of those hospitals, the softwares that they might be using, the amount of hardware that they have, that's imperative for the ABDM to succeed. As a reporter, I usually try to stick to the facts, but I was asked to give in my analysis, 2 bits of analysis from whatever I've covered so far. What really strikes to me about the mission is that it's quite gargantuan. And no, none of us should really be expecting it to take off in a few months or a year or so. If we look at the scale, diversity of India, the scale of it really hits us then, because you're going to have to digitize local level hospitals for this. You're going to have to get so many private sector hospitals on board for this. So it's really going to take a lot of time. We're also going to need to tackle the shift in mindset that will also have to come in if we want something like this to succeed. So a shift in adapting to digitized health records, adapting to on behalf of a doctor, the doctor adapting to locking their prescriptions and notes electronically instead of physically. Of course, then at institutional levels, dealing with all of these new different systems. So all of that's also got to come in. Just to come back to that point, to my point, I think it's going to take a lot of time. But I hope that in 15 years, we can look back and say that, yes, we had this idea and we did it.